But first, your medical minute. Arthritis pain can not only be uncomfortable, but it can impact a person's quality of life. Saltzer Health orthopedic surgeon Dr. Chlebeck explains this inflammatory condition and shares a possible surgical intervention. So what is arthritis?
So arthritis is essentially wear and tear on the joint surface, kind of like the tires on your car. That cartilage over time, which is the cushion for the joint, wears down. There's predisposing things to arthritis, some of which are genetic, some of which are related to trauma, but the kind of osteoarthritis, which is the main type of arthritis, is just wear and tear over time.
Okay, and what are the options then for treatment if someone has arthritis?
So we have a lot of options for treatment available to us, most of which are non-surgical, and then obviously joint replacement, which everybody has heard of. Non-surgical options start with maintaining a healthy body weight and lifestyle, which can certainly ease some of the stress on the joints. And then medications like Tylenol, anti-inflammatories like ibuprofen or Aleve. And then we have injections like steroids, synthetic lubricants, even some products from your own blood that we spin down that have an anti-inflammatory effect. But those are kind of the mainstays of treatment.
Okay, tell me more about joint replacement surgery. What's involved with that?
So joint replacement surgery is where we remove the end of the bones in the tibia and femur that are basically worn down and hardened due to the lack of cartilage, and we cement on a prosthetic which is made of metal, and we use a bone grout to get that to hold onto the end of the bone. And then between that is a piece of plastic, which sounds pretty simple, but there's a lot of research that goes into that plastic to make it wear the least amount possible. And so you actually walk on a metal on plastic interface.
And does something like this need to be done in a hospital setting? And if so, how long is the stay for that?
Most commonly it's done in a hospital setting. That's changed a lot over the last 10 to 15 years to the point where younger, healthier patients can be done on an outpatient setting where they either go home the same day or stay overnight and go home the next morning. But I would say the majority of patients stay one night and go home the next day.
And what's the recovery process like?
So for a knee replacement, it's pretty sore for the first 2 to 4 weeks, and so it's not kind of a trivial thing we jump into without putting a lot of thought into it. But after about the 4-week mark, people are starting to cruise pretty well. The first couple weeks they're on a walker, and then they go generally to a cane, and then hopefully back to nothing.
And what are the biggest myths, though, surrounding this type of procedure?
I think a lot of people think of knee or hip replacement as, oh, I'll just go get my knee done and I'll be good as new. And, you know, there's no such thing as a small surgery. And so we take it very seriously, and we don't dive into surgery without trying all of the easier, non-operative, safer measures first.
Thank you so much.